adult patients go on clinical trials as compared to adult patients in other countries or pediatric patients in this country who accrue to trials at an unbelievably high rate. And to fix that, we're going to have to understand what the barriers to accrual are. And this next paper is an attempt to sort that out. It's entitled Patterns of Decision-Making About Cancer Clinical Trial Participation Among the Online Cancer Treatment Community, a collaboration between the Southwest Oncology Group and NexCura. This will be presented by Joseph Unger, who's a doctoral candidate at the University of Washington and a statistician and health services researcher from the Southwest Oncology Group Statistical Center at the Fred Hutchinson Cancer Center in Seattle. This will be presented tomorrow in a clinical science symposium entitled Optimizing Delivery of High-Quality Cancer Care, and that'll be at 8 a.m.
Thank you, Dr. Roth, and I'd like to thank ASCO for the honor of presenting this study today. So I'm going to present a study regarding patterns of decision-making about cancer clinical trial participation in the online cancer treatment community. This study was a collaboration between SWOG, which is a National Clinical Trials Consortium sponsored by the NCI, and the company NexCura, which is a provider of online treatment decision tools for cancer patients. And I'd like to start off by thanking my collaborators, each of whom made important contributions to the study. I'd like to thank in particular Drs. Hirschman and Albane, who are in the audience today. I'm going to defer all difficult questions to them. Only about 2 to 3% of adult cancer patients participate in NCI-sponsored clinical trials. And while clinical trial enrollment by age, race, and sex has been well studied, participation by income is not well studied, largely because patient-level income is rarely available. Also, these studies typically have poor accounting for patient medical conditions, which can be an important confounder. So our objective was to assess clinical trial participation by income and other important socioeconomic status and demographic factors accounting for patient medical conditions. As I mentioned, the study was conducted in collaboration with NexCura. They were a provider of online treatment decision tools for patients with cancer. I should mention that their company was recently sold, so you will not be able to find their website any longer, unfortunately. So adult cancer patients with a new diagnosis of breast, lung, colorectal, or prostate cancer were surveyed after their treatment decision. The survey took 4 years to conduct, ending this past July, and included data on income, education, age, sex, race, distance to clinic as a surrogate for convenience, and medical conditions. A total of 5,500 patients were surveyed. The overall clinical trial participation rate in the survey was 9%. In a statistical model in which we accounted for all SES and demographic factors as well as patient medical conditions at once, patients with income less than $50,000 per year were highly statistically significantly less likely to participate than patients with income of $50,000 a year or higher. Importantly, this finding was consistently strong regardless of how income was categorized. As one example, patients with income less than $20,000 per year were 44% less likely to participate than patients with income of $20,000 per year or higher. Concurrent with that finding, we also observed that concern about how to pay for clinical trial participation was much higher among lower income patients. Specifically, 53% of patients with an income of $20,000 per year less were concerned about how to pay for their trial, compared to only 24% among patients with an income of $100,000 per year or higher. And finally, the observation was consistent even in the insured subpopulation of patients 65 or older who are covered by Medicare, indicating that insurance access does not necessarily explain the findings. The NCI has summarized the evidence in the literature as stating that clinical trials are not appreciably higher than for non-trial care. Nonetheless, as shown in this study, patient cost concerns are much higher for lower income patients, suggesting that in the context of deciding about clinical trial participation, lower income patients may be more sensitive to direct costs, including such things as copays and coinsurance, or they may be more sensitive to things like indirect costs or hidden costs of participation, such as having to take time off work for extra clinic visits. We believe the future work should seek to clarify what the specific cost barriers are, and the policy implications follow naturally from these concerns about costs, namely to devise policies to help lower income patients with the direct and indirect costs of clinical trial participation. So to summarize, lower income was associated with lower clinical trial participation and greater concern about how to pay for clinical trials. We think that this is important from two perspectives. From the patient's perspective, since clinical trial treatments offer state-of-the-art treatments, this finding raises a concern about whether all income levels have equal access to trials. And from the clinicians' and researchers' perspective, better participation of lower income patients could speed the conduct of clinical trials and better assure the applicability of clinical trial results to all income levels. Thank you.